Welcome, everyone. We will get started in just a few moments as all participants are still joining the webinar. All right, I think we're at a good spot to get started. So let me welcome you all. Hello. I hope you're having a wonderful day wherever you may be. My name is Lindsay Streeper, and I am the Senior Director of our Marketing Communication team here at Magellan Federal. And I am going to be your moderator for our webinar today on creating safe communities, protecting LGBTQIA plus mental health. If you are new to Magellan Federal or our Magellan Federal MFED Inform series, welcome. We're really glad you found us and that you've joined us today. So our MFED Inform series is Magellan Federal's Insights blog, and we really share valuable health and productivity solutions to those connected to the federal government on that website. So to get to the blog, you can go to the URL. It should be right there at the bottom left of this screen. It's mfed.info/inform. And once you get there, you can subscribe to get alerted about any new resources we have available, such as webinars like this. All of our resources are free and open to the public. So before we get started today, there are just a couple things I wanted to mention so you can get the most out of your time. In the first part of the webinar, we're going to be sharing the wonderful content that our panelists have prepared. And at the end, we're going to take your questions with any remaining time that we may have. This webinar is being recorded for future on-demand viewing. So if you're watching it at a later date, thank you very much. All registrants are going to receive a replay after the call, and we hope that you'll forward that to anybody in your network you think might find our resources valuable. Your lines are muted throughout today's session, but you can ask any questions that you have by dropping them in the Q&A button at the bottom of the Zoom window and put them in there. And we're going to be answering them throughout the call as well as answering some live at the very end. So thank you all for joining us, and let's go ahead and get started. Next slide. So before we dive into the agenda and what we're going to cover, I just wanted to get a little bit of a background on who Magellan Federal is, if you are not familiar with us. We are a government contractor with headquarters in Arlington, Virginia, but we have employees all over the world at government installations and agencies. We deliver sensitive, complex wellness services. And our mission is here on the slide. It's to inspire healthier, more productive communities by delivering innovative, total well-being solutions to the federal government, military personnel, government employees, and their families. It's a really wonderful mission, and it's what's really given me pride to be a member of the Magellan Federal team for nearly 13 years. So we do deliver these service and staff offerings in areas such as mental health, substance abuse, family support, fitness for duty, wellness, coaching, care management, veteran benefits, and various administrative professional services. And that's a lot of the content that you'll see on the MFED Inform blog as well. You can get a lot of information there. So that's a little bit about us. Please go on to the next slide so we can review what we will be discussing today. So as you know, June is Pride Month. And we thought this was a great opportunity for us to share information and resources available to support the military and federal families with LGBTQIA youth. So today you're going to hear from our panelists. All are members of our Magellan Federal team or our parent company, Magellan Healthcare. And you can see their lovely faces here, and you're going to get to meet them and hear from them today. They're going to introduce themselves as they speak during their sections as well. But in our time today, we're going to cover, Ms. Deandra Judge is going to provide a welcome and overview, and she's going to set the stage for what we'll learn. Jane Carey is going to cover the challenges of mental health among military and non-military connected LGBTQ youth. And then Austin Hoffman will share his lived experience with military youth and the protective factors that can enable support. Then we're going to provide you with some really useful resources for you to take away for help and to support the mental health of this population. And finally, as I mentioned, we're going to have time for Q&A at the end. So whether you are a professional or a parent, there's going to be something here for you today. So let's really dive in with our first presenter, Deandra Judge.
Thank you, Lindsay, and welcome to everyone. We are so excited to have each of you here, whether it's live or if you're joining on the on-demand view. Thank you so much for tuning in. We are so looking forward to sharing with you a lot of good information about LGBTQIA plus youth and the mental health experiences that they're having. And our hope is that from what you hear today, you'll walk away not only informed, but hopefully encouraged and with a better outlook on how we can continue to support and protect youth, both within the military and in everyday society, who identify as a member of this amazing community. And so we can go to the next slide. So before we dive in and you hear from Jane and Austin, I did want to set the stage to just share a few bits of data that I do think is critical when processing or hearing a lot of the information you're going to hear on this afternoon. I think it's important for us to know that within America, 7.2% of individuals identify as either gay, lesbian, bisexual, transgender, or something other than heterosexual. That means you probably know at least one person who is a part of this community. Within that population, at least 7 to 9% of our youth identify as lesbian, gay, bisexual, transgender, or queer. And as you'll hear throughout this presentation, our youth are some of our most vulnerable individuals who are experiencing different aspects of mental health challenges at alarming rates. But again, we want to make sure that we balance that information that is critical for you to hear today with also ways in which that we can improve the health outcomes for our youth and also their experience in life. And so buckle up, get ready, and I hope that you really take something away from this. And we're going to pass it over to Jane Carey.
Thank you, Deandra. I'm really excited to be here today to talk about a topic that is near and dear to my heart. Just to introduce myself, I'm a licensed professional counselor. I've been working with military contracts for about 17 years, and I've worked with adults, children, couples, families in a lot of capacities. And currently I work in Stuttgart, Germany with a resilience training program. And so personally, I have a wife. We've been together for 28 years. We have 7 children. We have fostered over the years, so we've had a lot of youth come through our home. So professionally and personally, I've worked with LGBTQIA plus youth. And so I'd like to share a little bit of information on mental health. And thank you. So of the 3 million LGBTQ plus youth in America, there are military connected youth. The Trevor Project has conducted some research. It's based on their 2021 surveys of LGBTQ plus youth. And out of the approximately 35 respondents, 5% identified as having a parent in the military. And this is significant because LGBTQ plus youth with a parent in the military do have significantly higher rates of mental health concerns, including suicide risks. And so that's one thing that I want to kind of highlight in this information this evening. Next slide. So first off, I want to look at just whether it's a military connected or non-military connected, LGBTQ plus youth. The Trevor Project has been doing research and surveying populations since 2018. So we have some really good data. This is from their 2023 report. And you can see with the numbers that 67% of youth report experiencing symptoms of anxiety, 54% symptoms of depression, and it gets alarming when you look at 41% of the youth seriously considered suicide, and then 14% attempted suicide. That's compared with 9% of the general population, but for youth. And again, this information is based on youth between the ages of 13 and 24. And it's, as I said, the numbers are pretty consistent over the years. Okay, next slide. So I want to look a little bit at mental health among military connected and non-military connected. So with the scale, the orange shows youth with a military parent, and the blue shows non-military parent. And you can see that there's significantly elevated rates of depression, anxiety, suicidal ideations, and suicide attempts, especially the numbers for considering suicide. 49% of the military connected dependents who had responded. And that ends up being about 1,700 youth, military connected youth, that are represented in these numbers. But 49% seriously considered suicide. And then if you look at the suicide attempts, 23%. These numbers are alarming. Okay, next slide. So one thing I really want to point out is, and this is something the Trevor Project has said, but I also just personally want to point out that the youth are not inherently prone to suicide risk because of their sexual orientation or gender identity. It's more that they're placed at higher risk because of how they're treated in society, how they're stigmatized. And personally, I've seen this in the youth that I have in the home, as well as others that I've worked with. And it's significant that there's something that can be done about this. So society's message that they send to our youth can really make a difference. Next slide. So I want to talk a little bit about the unique risk factors for the LGBTQ plus youth, because there are special situations that add to mental health concerns. There is definitely physical harm and bullying. And I don't think it's just in rare circumstances. It's a real concern that our youth have. And I have a son who is living in a fairly progressive state who was coming home to visit, and he had painted his fingernails rainbow colors. And he let us know, my wife and I, hey, I just want to let you know, I'm concerned that I may have some problems, but this is me and this is what I want to do. Luckily, he didn't. He received a lot of support. But it is something that is in the back of your mind that youth have to consider. Of course, you see on here discrimination, housing instability. This one is significant because the majority of reasons that LGBTQ plus youth have issues with housing instability is because they get kicked out of the house or they run away from home. There is a high representation of the LGBTQ plus youth amongst the homeless youth. And so it is a real concern. That comes from the rejection from family and community. Not having social support and affirming places to be able to feel like themselves, to connect with other people. And just feel that support in a welcoming environment. And hostile or unsafe school experiences. There are many youth who either drop out of school or the parents choose to homeschool because the school experience is not welcoming or safe. And studies have shown that in schools that where the schools are supportive, your mental health risks are less. So it really makes a difference. Okay, next slide. Okay, so there's good news. There are ways to reduce the risk. We call these protective factors. And in just a minute, Austin is going to talk a little bit more on this subject. But having supportive environments in school and community, just mentioned that. Cultural and or community connections, that's just very important. For the youth, it's really important that they see representation in society or in the media. And that's the reason that it's important for those of us to be visible and let them know that, you know, they're not alone. Having access to resources, whether that's books or access to support groups, and there are lots of resources that are there today that were not necessarily around 20 or 30 years ago. The Trevor Project, where a lot of the information is coming from, started as a crisis response to suicide for the LGBTQ population. The last one that I have on here as ways to reduce risk for our youth is supportive family relationships. That's one of the biggest protective factors for our youth. And having at least one accepting adult, whether it's in school, whether it's a neighbor, whether it's parents, can reduce the risk of suicide by 40%. That's really significant because you can make a difference in the life of a child just by being supportive. Being valued by family teaches kids to value and care about themselves. That's another reason that having supportive family relationships makes a difference. And it is possible to support your youth. Even if you feel uncomfortable about your youth's identity, it's still possible to support. So the next slide that I want to share goes back to military connected youth. And this graph shows, on the blue, it shows military connected youth who have support by their parents, by at least a parent of family members. And you can see that the rates of anxiety drop significantly. The rates of depression drop. Considering suicide, dropping from 45% to 29% it just shows how much this helps to have a parent that's supportive. But suicide attempts, it drops from 24% to 11%. And I don't think I have to reiterate how significant that is. So parents really can make a difference. Family members can make a difference. School officials, teachers, the whole community, the society can really make a difference in sending positive messages to our youth. Last slide. Okay. I just want to mention some of the resources for LGBTQIA plus youth and families. So the Trevor Project, I've mentioned this, this organization. It's a nonprofit. They offer crisis support, so youth can call in crisis. They offer advocacy, research, education. They also have something called Trevor Space. It is an online community. It's a moderated community, about 400,000 youth. It's international, where they can call in and find that connection with their community. PFLAG, this organization has been around since the 70s, and they have a virtual moderated monthly meeting for military connected families. PFLAG stood for Parents and Family of Lesbian and Gays. Over the years, they kept the name, but it encompasses all youth who identify LGBTQIA plus. And this specifically being a military connected option is important. Mil Pride. So the Modern Military Association of America is an organization for LGBTQ plus in the military, serving the military or retired veterans. But they have a program called Mil Pride, and it's for families with LGBTQIA plus youth. So they also have support there. And I have to say that Military Child Education Coalition, which advocates for youth in the schools, are very proactive for our youth, our LGBTQIA plus youth. And there are a lot of resources, and you'll see those at the end. But I just encourage you to look into some of this and just be aware that you really can make a difference. Okay, now I am going to hand it over to Mr. Austin Huffman.
Thank you, Jane, and thanks for sharing that valuable information. So I think it's important here to pause. I'm going to provide a little context to my background and the unique intersectionality that I have in the lives of military youth and in turn with behavioral health and mental health. So I am a master's prepared nurse. My background is originally in critical care. A large portion of my career was with military youth, working directly with the Navy. And, I'm also a military family member. So I've experienced, healthcare and the military community from that perspective. And then when my spouse transitioned away from active duty after 14 years of service to the reserves, we kind of made a change, and I moved into the space I'm currently in now, which is working in Medicaid behavioral health with Magellan. So really kind of crossing the gamut there of several aspects of the backgrounds of, military youth, behavioral health, mental health, physical health, and the LGBTQ plus community. Next slide, please. So as I previously mentioned, I'm going to share a little bit about my lived experience with military youth. That being said, like I said, my background is primarily in critical care. So pediatric critical care for the Navy was a big part of my career. So when I did see individuals that were struggling with these issues that we're going to talk about directed towards mental health, these were after crisis incidents. So, after suicide attempts, potential intentional overdoses, things of that nature, where they were physically recovering as well as, starting their mental health journey. So as I previously mentioned, I am a military spouse. I worked in the Navy's pediatric intensive care unit for 6 years. And then prior to that, worked with many military dependents over 18 months before working directly for the Navy. The facility that I worked at served as a primary training center for pediatric care. So patients and staff represented all branches of the military. So, any individual that was in any branch of the military that was going through their medical training and wanted to specialize in pediatrics, kind of worked their way through that facility and did a rotation in critical care. So a lot of exposure to individuals of different ages, as patients that were military connected, and then also working with military members as they were advancing their careers in medicine. So during my tenure with the Navy, as I previously mentioned, I saw many youths affected by anxiety, depression, eating disorders, illicit substance use, and suicide attempts. And like I said previously, my initial interaction with these individuals was after a crisis moment. So really when they needed medical support, and then you would work on that medical support and then advance into, the mental health, behavioral health aspects of that. Some things to mention here that were in high prevalence in the military community versus general population was eating disorders, substance use, and suicide attempts. And for what's listed here, particularly for eating disorders, it was more prevalent, and this was communicated directly from youth that was the only way they felt control in their life. So, when they weren't weren't really in control of where they were going to school, where they were living, those type of things. This was a way of controlling their life. So if it was controlling their food consumption or illicit substance use, or feeling like they had no perceived control, often leading to suicide attempts. So next slide, please. So Jane had previously mentioned some protective factors for LGBTQ plus military youth. So I think it's important to recognize that in this community, that protective factors are not in place for the general public and the military youth in the same equity. There's additional barriers to those protective factors in military youth, and I'll go over those now. So support systems can be strained in military families. They move around often and don't often have a local support system or extended family in the area, long-term friends. With these individuals as part of their career, moving around the country, around the world, you don't have that support system that the general public would primarily have in living somewhat close to their extended family in a lot of instances, or being a part of a community for an extended period of time where you're familiar with neighbors, you have a friend group that you can lean on. That's often removed for these individuals where they don't have that consistent support. They may have support from a more varied perspective, but they don't have that proximity to those support individuals. Particularly for military youth, again, moving every few years strains the youth to maintain friendships and develop new ones. So thinking about a child and how hard it is to make friends and how they make those connections, to then move around and try to keep those friendships as a strain, but also always being the new person and attempting to create that support system and friend group is a bit tiring and exhausting when you're continually going through that. So you don't have that consistent friend group potentially that is there to support you. And it's important to note here that youth may be at higher risk for mental health concerns directly before or shortly after a PCS or permanent change of station move. Those are those moves that I talked about that, depending on the branch of the military and the career path, you may be moving around every 1, 2, 3 years. It may vary depending upon promotions and things of that nature. So, that's a stressor point there. So right before, these youths are thinking about potentially losing the friends they've developed over that period of years, thinking about going to a new place and having to start over. And then also once getting there, the realization of having kind of separated from that friend group geographically and then trying to create that new friend group is definitely a stressor and can impact mental health. Another thing to note here, school support staff are less familiar with youth's normal presentation. And, in most cases, children or youth, when they're going into a new situation, aren't going to be, there's exceptions to the rule, but probably going to be a little more quiet, a little more reserved, not sure, who they're going to try to be friends with, how much they want to share about their life. So, they're a little reserved traditionally in that presentation. So then those early warning signs of kind of being a little bit disconnected, being a little more quiet, that's already part of the presentation ahead of time. So it may take a little bit of time for those individuals that are in that capacity to kind of realize that maybe there's a moment here to intervene. So speaking on just kind of moving around and not necessarily having that developed local support, is they may not have developed a relationship with a local support person if they contemplate self-harm. So if they don't really have a group of friends they're comfortable with, they don't know who they can turn to. In most cases, typically individuals wouldn't turn to an immediate family member. It would be someone a little bit removed from that situation. If they're moving around and they don't know who to go to or who they can trust with that information, or, not really even wanting to share that if they don't have a solid friend group. So next slide, please. So an additional consideration regarding protective factors is legislation. So we're just going to talk broadly about legislation here and how it can impact mental health among the LGBTQ plus youth community and the military community. This is an additional consideration because military families don't get to choose where they live. They are they rank the options that are available, but they're ultimately told where they're going to go, so they don't really have a control over where that is. So legislation is being proposed across the country that impacts the mental health of LGBTQ plus youth. And this legislation can directly or indirectly impact the youth. It can limit care to the individual or the community. And it also may decrease representation and support systems. If you're in a climate where that's not really readily accepted, you might kind of hide who you are. So you lose that representation, you lose that support group. And then another important factor to consider here is even if a youth lives in a location where the legislation is not likely to pass or does not pass, it still affects their mental health, as it may feel like an attack on their individual identity or the community. Next slide, please. So the good news here is, Jane did share some protective factors that are in place. These are specific actions that individuals can take to enhance those protective factors for military youth and overcome those barriers that I previously discussed. So one of the very important things to do here is to foster a sense of social support. So there's some simple steps that can be taken here to foster that sense of support. So, introducing yourself regularly to, a military youth and checking in regularly with that individual. They're in a new situation. You're aware of that. You're aware that they're new to the situation. So be that person that reaches out to them and, strikes up that connection. So that can enable you to be that person the youth turns to in distress. An easy way to do this is to show interest in backgrounds and hobbies. So, finding out a little bit more about the individual. If they have an interest in a sport, you can connect them with a sports team if it's in a school situation. If they have a different interest that is not necessarily focused on sports or school, you can use your knowledge of local resources to try to connect an individual with, a peer group that might have similar interests, and that fosters that sense of community. You can introduce the youth to peers. So simple step, just introducing that individual and taking that stress away from that person to go up to people they don't know and saying, hi, I'm so-and-so, I'm new, here's my background. You can take that opportunity to just introduce that individual to someone and say, oh, so-and-so is new here. They're great. Here's something I learned about them. A simple step like that just kind of takes the stress away from the individual of introducing themselves. So I did mention this briefly before. You connect activities that fit interests. So either peer groups that fit interests, or if you're, if you're familiar with the local resources, like if a youth was interested in, movies or something, and there's a local theater that shows movies, like historical movies, or, those type of things, or there's a club that you're aware of, you can connect that individual with those resources, and that fosters a sense of community. Next slide, please. A really important step here is to be an ally. And what does being an ally mean? It means listening, being open-minded, being non-judgmental, and willing to talk. Some simple steps we can take here in youth in general and military youth is, a lot of people tend to ask teenagers and, younger youth if they're in a relationship, but typically they would use gendered terms. If it's someone they would consider identifying as a male, they would say, oh, do you have a girlfriend? Or vice versa, do you have a boyfriend? So, a simple way here to show that you're an ally and you support individuals is just saying, are you dating anyone? Versus, do you have a boyfriend or girlfriend? That simple step of saying, are you dating someone? If you don't know the status of that individual, they might go, hey, this person could be someone I could turn to. They didn't make any assumptions. They showed interest in my life. Simple step like that can really, really open the door for someone. So this is also a very important one. Standing up and being an ally, saying something. So anti-LGBTQ plus comments, jokes are harmful. Correct people and tell them you find their remarks offensive. Standing up and having someone see that can really turn the tables in showing support for that person and being like, I know that person will support me if I need them. So confront your own prejudices and biases, even if it's uncomfortable, and really evaluate, how you interact in certain situations and how you can be more supportive. Believe that all people, regardless of their gender identity and sexual orientation, should be treated with dignity and respect. Just treating everyone with dignity and respect is really important here. Next slide. And thank you very much. I'm going to pass it back to Deandra.
Thank you, Austin. So we want to share a few resources with you. We can go to the next slide and point out a few that we have listed here. When you receive the slides, I want everyone to know that that first column that says organization is hyperlinked. So you can click right on the names of these organizations and be taken to the specific resource that we are recommending. Because we are highlighting military youth, I want to reiterate PFLAG and Mil Pride that you see on this particular chart that Jane mentioned as great resources for youth and families and caregivers who have youth who identify as LGBTQIA. We also want to highlight the Fenway Institute, which is a healthcare and research organization. It's really great for those who are healthcare professionals and adults and parents of LGBTQIA plus youth as well. And then another one is the LGBTQ plus healthcare directory, which I think is really of note in this context with military youth, considering what Austin touched on, permanent change of station or PCS, when we have individuals who are moving and relocating throughout the country, sometimes being able to stay in contact with your previous medical provider or healthcare provider may be challenging. And so this particular directory actually is searchable database of doctors and medical professions who are specializing and focusing on the needs of LGBTQ plus individuals. In addition to this slide, you'll also see at the end of this presentation a list of references that we spoke to throughout the presentation. So make sure you check out those links as well. And then we also have a handout that we're going to give that just goes into more detail about additional resources. Our goal is that even though you may have heard some statistics that can be a little bit daunting, to be honest, and be very heavy. We want to make sure that you know that there is help, there is resources that can inform us, that can help educate us and others, but more importantly, affect positive change. We want to make sure that our youth are supported in every way possible. And the one way that we can do that is gaining access to those resources and then sharing them with others. And so we hope that this presentation was both informative, helpful, and enlightening, but most of all, encouraging. So thank you.
Thank you, Deandra, and the rest of the panelists. I'm going to move into the Q&A portion right now. So let's change it so you guys can see all of your panelists. Go ahead and enter any questions that you may have into the Q&A, and we will turn it over to have the panelists answer them for you. Let me see here. Kaylee, you can go ahead and close the slide deck there, and so everybody can see everyone. All right, so we did have a couple questions come in before the call, and so I wanted to ask those to our panelists right now. Austin, I think you're probably best suited for this one. Where can individuals go for local resources or questions? So locally, any suggestions?
Sure, I can touch on that. And I see Arlene's question as well. This kind of ties in to some information that I have that might be valuable. So Arlene's question is talking about high risk for housing displacement and poverty and how that affects LGBTQIA plus families disproportionately, and how do we address that? That's definitely a larger conversation here, but going over some local resources or where you can seek out local resources is a great start to that, to kind of address the immediate needs of those individuals. So talking about lack of resources, lack of housing, lack of accessibility to funds and things of that nature. A great resource for a lot of people that, that are not necessarily these national organizations that we hear about there are most bigger cities or regions throughout the country do have LGBTQIA plus centers. So really anywhere that you are, if you Google saying, LGBTQIA plus center, city near you, region that you live in, you're going to get most likely get a hit that's relatively close to your location, where you can reach out to that organization, and they're going to be a wealth of resources to give you information and really look at your unique situation that individuals would be reaching out for. And, in a lot of cases have resources that aren't readily available to the public or known to the public because they specialize in these, unique situations in this unique community that they might know of resources that are not readily advertised. That being said, there's organizations all across the country. If you live in an area or region where you're not closer to, some type of urban setting. So for example, for me, I'm in Pennsylvania. I live, an hour and 15 minutes outside of Pittsburgh. So if I were looking for resources and I didn't know who to turn to, there are multiple, centers in Pittsburgh that would either know about regional resources that may not be, readily known, or would be willing to connect you with resources that are close to your region. Because in a lot of instances, these resources are willing to travel and help these individuals. So that's a great way to really find a wealth of resources and get connected. And if they can't personally connect you with, a resource, they definitely can point you in the right direction.
That's really good information, Austin. Thank you. Thank you very much. There's another question in queue right now. It says, what ages are covered when discussing youth in this presentation? And that's a good blanket question for youth in general. Is it birth to 18, or is there an age range that you found most of the research was based around? Oh, Janet, I don't think we can hear you there. You might be muted. Still having audio issues. Are you guys, Deandra?
I can't hear you as well, Jane. If you could type it for us.
While Jane is typing, Deandra or Austin, did you, for the sections that you covered, were there age ranges for the youth?
So I didn't specifically look at any, I spoke to my lived experience. So my interactions with military youth kind of fall in the realm of medical physical health and what's considered youth in that perspective, and when they can continue to have pediatric care if they have pediatric care. So that is actually up to the age of 24. So, from my experience perspective, I didn't look at statistics or report statistics, so I'm not exactly sure what youth is considered there. But, my experience lies between anywhere from newborn up to 24 years.
And it was youth ages 13 to 24 is what was covered in the research.
Got it. We can hear you now. Thank you, Jane. Perfect. All right, looking through the Q&A here. This is a really good one about support. So how do the panelists here suggest working with or otherwise helping LGBTQIA plus youth military parents if they are unsupported of their child? So is there any suggestions you have from your counseling experience or any resourcing experience to sort of work with the parents who may not be supportive specifically?
So just listening to the youth, just letting them know that you're accepting and that you value them for who they are, and just listening is going to be one of the best things. Pointing them in the direction of some of the resources that are available, and yes, that would be the biggest thing I would say.
Austin or Deandra, do you have anything to add to that?
Sure. I would also just add, this is just for whether you're in the military or not, parents, adults, caregivers, advocates. I think it's being vulnerable enough to share what you don't know, like just own what you may not be sure about when an individual is sharing their experiences with you. To Jane's point about listening, I think it's also important that we learn to listen without judgment. And we all have our own, cultural backgrounds, education, lived experiences that help inform how we navigate the world. But being able to put some of that aside when we're listening and try our best to not filter it through our own personal lens and really take what individuals are sharing with us, especially our youth, for their reality, and honoring and respecting what is being shared in that space and in that time with you. And that to me is just necessary in order to become someone who is a safe space for an individual, and just cultivate that trust.
Great. That was a really good question. There's a question here about speaking about your experiences about resilience of military children and teens and how parents and others can foster that. So resilience means a lot of things, obviously, to a lot of people, but can you speak to sort of any lived experiences you guys have around that?
So I'd like to speak to this one. Military kids are very resilient, but opening up, keeping communication open, even if you need to get involved in some kind of resiliency services to open up the communication. But I think that learning how to talk to your kids, encouraging them to talk, asking them questions can help increase their resilience. And getting involved in the services that are available.
DeAndre or Austin, did either of you want to add anything?
I can kind of echo what Jane was saying here. You know, that this youth group is extremely resilient. I think the easiest and biggest step anyone can take is just showing up and being a support person, just showing that you know, are an advocate and ally for those individuals. It's that simple step that, you know, you can just really show that you're there if they need you, you're ready to help them. You know, a simple step of just doing that is the way you can support resiliency.
Thank you. And I see a question in here, just to confirm, we will be sending these materials to all people who registered, and you are welcome to forward those materials to the presentation. There is also going to be a handout with additional resources that DeAndre mentioned. So that will be sent after this, and just to confirm. And it will also be, you can download them at any time from MFED Inform, the blog that I mentioned, which we'll show again at the end of this call. Let's see if there's any other questions here that we want to address with the group. Working with youth, I have found some youth feel they must hide who they are due to fear of their parents' reactions. How can we best support these youth?
I think that being visible, being accessible, kind of like Austin was saying, when the wording that you use, make sure that it's open-ended and they know that that you're not identifying them as having a girlfriend or a boyfriend. So the language that you use, just showing that you're open to listen to them. Military kids, all kids, want you to know that they want you to ask questions if you have questions. And so approaching military kids and just being open and even asking questions sometimes.
Here's a good question about overseas youth, so in the military. So services are more challenging overseas for teens in the military or with military parents. What are the best resources for these individuals?
Well, for my base, there are, I have to type it in. High school,
Oh, Jane, I think you're cutting out a little bit. Sorry about that.
I can type it in.
And Jane, you shared where you were located, and that's maybe some of the connectivity issues here.
And I can touch on this as more of a widespread location of resources. So, you know, there is the U.S. Department of Health and Human Services that does have a branch of LGBTQI plus health equity. So they're a great resource to reach out to. You can check out that website on the Health and Human Resources and look for that specific branch of that service and kind of reach out there, and they could probably connect you with any resources that are available for military, or in situations where you're not in a typical situation where you could look for local resources.
I don't know if my audio is back.
Yeah. Yes.
Overseas, there are the high school where I'm at has for LGBT organizations.
We're hearing every other word. Sorry, Jane.
So I'll add a little bit to what Jane was saying, because I know I've heard her mention it once before, but she works within schools. And so sometimes it's looking at the different resources that are connected to the schools where your youth is, even if you're overseas, because there may be opportunities to engage with some of the youth activities that are provided at that particular education center. And so that would be one way that if you're located overseas, you will have some connection to resources that are most likely going to be accessible to both the family and the youth. Jane, hopefully I covered that.
and yes, resources are limited overseas for all types of health concerns, but just being able to reach out to some of these international resources. Trevor Space involved with, and the other military resources. If parents are able to, if children are willing to, belong to some of those.
And I'm seeing, I'd like to address something here too. I'm seeing a couple of questions that are coming across about, how to support LGBTQIA plus youth when, the parents or guardians are not supportive or not willing to continue, if it's in a treatment modality, working with a therapist or something of that nature. Unfortunately, there's not too much you can do, because you can't go against the parents' wishes, but still continuing to show up and support that individual, letting them know they're there, that you are there for them if they need you, continuing to be an ally for them. And if you are concerned for their safety, you would report it like you would any concern around safety. So, if you're concerned about abuse, or you're concerned that they're, potentially going to take their lives, that's an action that you can take, as if you're worried about the actual physical well-being of that individual. That's something that you can do. Other than that, you can't really go beyond a parent's wishes. So just showing up and to continue to support that individual, saying, I'm here for you if you need me. I'm an ally. I'll listen to you whenever, and just kind of supporting them in that way.
Yeah, that's a good tip, Austin, giving them someone to talk to if they don't have it at home. It's a really good tip. Anything else you want to address from what you're seeing in the questions here from the team?
There was a question about counselors in the DoDEA schools having resources. There are some, but this is something new awareness, I think. But from what I've seen, yes, the counselors do have resources in a lot of them.
Deandra, any closing thoughts before we wrap it up and give you guys some of your day back?
No, just a big thank you to Jane and Austin. Thank you, Lindsay, as well, and Kaylee, and to all of you all who tuned in. We really appreciate it.
Yeah, I would echo that. We really hope you got something out of our session today. And Kaylee, I'm going to have you put up that last slide one more time so people can refer back to where you can get this replay, as well as more information and resources on other topics that we have posted there for you. And please feel free to sign up. You can use the QR code there or take you straight to the registration page, and you're going to get an email, not too frequently from us. We're not going to spam you, but it will be once a month or so with any new resources or new webinars that we might have. You can also always reach the team. So if you think of something after the call today that you want to address with our panelists, we have an email there for you. It's mfedinform@magellanfederal.com, and it's a monitored inbox. We can always get your question to the right person and subject matter expert for you. So thank you all very much for attending again, and enjoy the rest of your day.